This is Dr. Mehdi AdibRad. I hope you guys doing well. I am a board certified periodontist and also a dental surgeon practicing in Toronto, Ontario for the past 14 years. I'm the head instructor at CONFITALK, and in this series of lectures, the CONFITALK, we're going to talk about different important subjects that are relevant to the licensing exams in Canada, but also can be used in your regular practice as a dentist, practicing here, like in North America or anywhere around the world. So our focus today for this lecture is on implant radiology. Okay, but this can be an important subject, especially for the ACJ exam and later for the situational judgment exam. So for you guys should be able to evaluate the implant on the X-ray in terms of the type of the implant, the type of bone loss, whether there is a bone loss or not, how much is considered as acceptable, how much is considered as concerning, and based on the clinical findings and the radiographic findings that you have, come up maybe with a treatment plan, which can be asked, as I said, in both ACJ exam and later in the situational judgment. My today main focus is actually on the identifying of the implant, the type of implant, its components. The most common implant brands that are available in Canada are being commonly used by dentists, placed by dental surgeons in Canada. And in the next lecture, I'm going to go talk about actually implant pathology and implant problems in terms of bone loss and the management. So let's begin. First thing first, we have to start with the terminology. So there are some important components of the implant that you guys are already familiar with. I'm going to go over and review to just refresh your mind. So obviously the most important thing that we should start with is the implant fixture, which is placed at the time of surgery. You raise the flap, or if you do flapless, you place the implant surgically after drilling the bone. And then based on the initial stability and your treatment protocol, the protocol you follow, you may place a healing abutment or a cover screw on top, okay? In some cases, you can go ahead and place actually a prosthetic abutment and consider immediate restoration. So I'm not going to go into that details. So I'm just talking about the regular routine implant restorations. And finally, once everything is healed, everything is stable, we place the prosthetic, we remove either the healing abutment or cover screw, depending on the treatment protocol. We eventually place the prosthetic abutment and prosthetic crown. Can come as a single unit, the case of screw retained crowns, or it can come as two separate units, like prosthetic abutment is placed and screwed first, torqued, and then a crown is cemented on the top. And these are not going to get asked in the exam, whether it's a screw retained or cement retained. Those are not relevant to the exam, but you guys already know about it. So I'm going to start with implant fixture. Super important in terms of you guys being able to identify the implant fixture in terms of its relationship to the alveolar crest. Okay, so implant fixture is a hollow titanium unit which is placed inside the bone, and eventually it gets also integrated with the bone, and it acts like a foundation for your final crown. Okay. We will talk about it later. We have two types of implant fixture. One is called bone level, in which the implant prosthetic platform is placed at the level of the bone or below the bone, or tissue level, in which the Implant prosthetic platform is placed at the level of the soft tissue or gum. Okay. When we look deeper, this is how actually an implant fixture look like. A hollow titanium screw. So when I say hollow, that's because inside of it, we have a room for the prosthetic screw, because the prosthetic screw is what connects the prosthetic abutment in the end. So this is going to be my prosthetic abutment. So there is a prosthetic screw that connects the prosthetic abutment to the implant fixture. And on top of that, the crown will be placed. Okay. And during the healing time, the healing cap, okay, or the cover screw, so cover screw, or the healing abutment or healing cap is actually screwed into this like housing, the housing for the final prosthetic screw, actually. Okay. So each implant fixture actually comes with different geometry, different design. And we have macro design and micro design. So we don't talk about micro design or microstructure because they're not clear, like radiographically visible. So our main focus in terms of implant fixture design is on its macro structure or macro design. And that macro design is mainly the shape of these threads. Okay. Most of the implants, they do have two types of threads. So we call them macro threads, which are usually more toward the apical two-third of the implant. Here we have macro threads. So the threads are more visible, more obvious, and they tend to be a little bit more like sharper and more aggressive. And then we have the coronal 2 to 3 millimeter, in some designs maybe a little bit longer or shorter, that we have micro threads. So the threads tends to be smaller, okay? And that's the case for the majority of the implants, like 80% of the bone level. So this is an example of bone level implant. We will talk about tissue level later. 80% of bone level implants, that's the design they have. So one more time. Coronal 2 to 3 millimeter or 4 millimeter, we have the micro threads, very fine threads, and the apical or the rest of the implant fixture has macro threads, more aggressive, more pronounced threads. Do you guys know why the design is like this? Do you have any idea why we have this structure? Why the coronal 2 to 3 millimeter has micro threads and the rest has macro threads? Why don't we have like macro threads all the way to the implant prosthetic platform? And the reason is right in front of you. The reason is because we have this implant prosthetic screw housing. Okay. So if we make like macro threads here, that makes the implant fixture neck, this area, very thin. And that increases the risk of implant fracture here. So we want to have the highest thickness, if possible, in the neck area, because this is one of the area we have the most of the implant load concentration, considering the micro movement of the prosthetic abutment inside the housing, inside the implant. Okay, so for that reason, we go with the smaller thread designs so we can have enough thickness in the neck area, which prevents the final, likely fracture of the implant body. Okay, so I will talk about implant fixture design more in details in the coming slides, but this was just a short and brief introduction of how the implant design works, implant fixture design. So once you place the implant fixture inside the bone surgically, as I said, depending on the protocol that you follow, usually if you are able to achieve good initial stability, like more than 25, 35 Newton centimeter torque, you can place the second component, which is called the healing abutment. So the healing abutment, it actually creates um, like an area for the soft tissue to heal against or heal upon. Okay. So the soft tissue, meaning the gingiva, will heal around this implant abutment. Okay. And when you want to take impression, when you want to scan it or take impression from the implant fixture, you simply remove the healing abutment, unscrew it, and now you have access to implant prosthetic platform, and you can place the impression coping and the rest. Okay. And this is how it looks like on the X-ray. So you can see the implant fixture is placed inside the bone. This is like a Hiossen implant, an Osstem implant, placed inside the bone, and this is the healing abutment, which is placed on top of it. Okay. So if you pay attention, you can still see the outline of the extraction socket. This is a case of immediate implant I placed like in the area of tooth number 37. And the healing abutment was placed on top because we were able to achieve a good initial stability. Okay. Looking at the adjacencies, you can see some composite restoration, amalgam restoration. This patient obviously has some evidence of attrition. You can see the flat occlusal table, no evidence of caries, the external oblique ridge, and the nerve. They are also visible in this X-ray. Okay. And you can see some evidence of pulp recession. Okay, there's some important points for you guys to like remember when you check X-ray. Just pay attention to all the relevant information, especially for the ACJ exam. If I'm not able to achieve a good initial stability, which can happen, especially when the bone quality is low, D3, D4, okay. Then I have to give more time to the implant to heal, and I should avoid any chance for occlusal overloading. For that reason, I place another component. Instead of healing abutment, I place the cover screw, which is similar to healing abutment, but this part is shorter. Okay. So in healing abutment, this part is longer, and this is the part which goes inside the implant hex, okay, inside the implant hollow, area. So this is where the screw sits, okay? And you see this is a shorter component in comparison to healing abutment. It's screwed inside the implant fixture, and the soft tissue is closed on top of it. So we have more time for the implant fixture to heal. And this is the case that in many scenarios when we are doing guided bone regeneration, GBR, we rather to bury the implant under the soft tissue. So we place a cover screw and everything is covered by the soft tissue, okay? So take a look at this X-ray. This is an interesting one. This case was referred to me for restoration of the crown. So I didn't place the implant. The implant was placed in another country. But the interesting thing is, if you pay attention, and this case was also done immediate, you can see this screw. You see this screw? So this is a screw, and this is the extension of the screw. So this is the cover screw. So this implant was not placed at the adequate depth, but the implant is placed a little bit too shallow or superficial. And you can see this is a bone level implant, as we will discuss later. So the implant platform. But since it was not placed deep enough, we already see some bone loss or thread exposure. from the get-go, from the beginning. Pay a little bit more attention to this area. You can see the extraction socket. And so these granules that you see, they are the bone grafts. So the implant was placed immediately and the socket was grafted with bone particles. And then it was covered by the tissue, but you can see we already have some thread exposure, some bone loss. Okay. The adjacent implant is also bone level, but I have some bone loss. Okay. And this X-ray is so interesting because this is just a review of what I discussed earlier. On the top, 2 to 3 millimeter of most implants, we have micro threads, and the rest of implant, we can see macro threads. Okay, more aggressive threads. Okay, why? You already know the reason. Because here we should have enough thickness for the prosthetic screw, for the cover screw, for the healing abutment. Okay, so we decrease the risk of implant fixture fracture later when the implant gets loaded. You can see the same concept here, micro threads and macro threads, okay? And this can be a little bit confusing sometimes because some implant designs, these micro threads are very, very delicate. They're very fine, and it may give you the idea that, okay, is this a tissue level implant or not? But if you pay closer attention, you can see some irregularities. And on a tissue level implant, we never have irregularities and a smooth collar. We call it a smooth collar of the implant in a tissue level. We don't have that feature. It's just very, very smooth, absolutely no irregularities. Okay. So yeah, some amalgam restoration, and I don't see evidence of periodontal bone loss. And the very interesting thing, I don't know if you guys already noticed or not, is this. Okay, always pay attention to these small details. You can see there is a retained root tip here. Look at the retained root tip. You can see even the gutta inside it. Okay. So we also, so it means like when they removed the tooth, they didn't take an X-ray and the root tip was left. It was left behind. Anyway, let's continue. After the healing, as I said, we remove the healing abutment or cover screw. If it's a cover screw, we replace it with a healing abutment. Eventually, the healing abutment is removed and the implant prosthetic abutment is placed, and it gets the screw by the prosthetic screw to the implant fixture. Okay, so you can see the prosthetic abutment here, and there is a screw, the prosthetic screw that connects these two. Okay, so this can be an example of a cement retain restoration, and on top of this, we're gonna have the crown which gets cemented. Okay, and this is how it looks like on the X-ray. Implant fixture, implant prosthetic platform. So implant fixture prosthetic platform. And then this is the prosthetic abutment. Okay. And the prosthetic screw that covers, that connects these two. Okay. This is a bone level implant. You can see all these irregularities all the way to the implant prosthetic platform. And it has a very mild platform switching. We will talk about it later. Okay. So that was like a quick review of implant components that you guys should know when you are radiographically assessing an implant. Okay. But by far, the most important part of the implant fixture that you guys should be able to tell, super important, is the implant fixture prosthetic platform. Okay? The prosthetic platform is where the implant crown, and when I say implant crown, I include the prosthetic abutment, sits on the implant fixture. So you guys should be able to detect, to identify the implant prosthetic platform. Very, very important. So whenever you see an X-ray of an implant, make sure you guys are able to tell, okay, this is my prosthetic platform. Okay. So you have to practice. It needs to see a lot of X-rays. And in this lecture, I'm going to go over some very, popular implants in Canada, so you guys can just have an idea like how the implants look like and where the implant platform is actually located. Okay, so take a look at this implant. This is a tissue level implant, and on a tissue level implant, this is my implant prosthetic platform. Okay, where on a bone level implant, this is a bone level implant. This is my prosthetic platform. So later the crown will come and sit here. Okay. And then here we're going to have the crown like this. Okay. And this is just a little bit relevant to our today's subject, but inside the implant fixture, we have this design, the hex design. So most of the implants right now, they have an internal hex. We also have the external hex implant. They're just used in cases that we want to place a very, very narrow implant. But the majority of implants right now in the market, they are internal hex, okay? Which means the crown will come and sit inside the implant fixture, okay? And gets screwed. So this implant is a very tricky one. If you guys pay close attention, you can see toward the coronal to the 3 millimeter, we have very, very, very fine, like micro threads. Okay, so maybe it's a little bit difficult in this picture to detect that, but this design is different than this one. Okay, that one tissue level is very, very smooth. Okay. Speaking of platform, implant platform, you guys should be familiar with the concept of platform switching. The platform switching means using a smaller implant prosthetic implant abutment on a wider diameter implant. So there is like a mismatch between the size of the prosthetic abutment and the implant fixture. Okay. So you can see this mismatch here very clearly. These are two implants that I placed like maybe 8-9 years ago. This is a BLX implant, and this one is a Hiossen implant. Okay, both of them are bone level. Okay, and this is the definition of platform switching. So if I have no platform switching, if this is my fixture, this is going to be my prosthetic abutment, and this is going to be my crown on top of it. Okay, so this is how it looks like. So I don't see any mismatch or any step here. But whenever I see a step, like here, I see a step, this is called platform switching. Okay, and you guys go and read more about the idea behind the platform switching. Is more about like this micro gap. So this by platform switching, this micro gap moves away from the crestal bone. From here, micro gap moves here, and the microbial pump that it may create just kind of moves away from the alveolar bone. We have lower risk of pre-implant bone loss. Okay, this is and it was just like the guy who found it by accident, and you can just go and study more about it in case you're interested. Okay, so one more time, mismatch. Pay attention to this mismatch. Okay, look at the implant fixture. BLX is also another good example of implants that they have microstructure and macrostructure, very, very aggressive threats, cases that you want to do immediate implant placement. This gives you a very good initial stability. This case, 237 was placed immediately. 236, sorry, 47 was placed immediately. 46 was placed delayed. And the Osstem or Hiossen implant doesn't have that design. So it means you can see the threads all the way from the implant prosthetic platform to the apex of the implant. But it's still, if you pay attention, the implants more toward the coronal part, they have like finer threads. And more toward the apical part, the threads become like more aggressive. The thread becomes more significant and pronounced. Okay. You can see a PFM crown, the post. Root canal is it has a little bit low density, maybe a little bit underfilled. Some evidence of calcification, composite restoration. Okay. Defective restoration, defective crown, margin is open. Okay. And some evidence of pulpal calcification. Okay. Another example. This is another example of, this is a really nice example. Actually, we have two implants, one with platform switching and the other one without platform switching. Okay. So this is the implant that I placed, another Hiossen implant placed probably several years ago. This implant was placed back in Iran by another surgeon. And you can see some evidence of pre-implant bone loss already here. Also some evidence of recurrent caries. And a composite restoration, bracket, and wires considered as orthodontic appliance. The fact that you see the root is like touching the implant is not necessarily like a proof that the implant is touching the root, because this can be because of the X-ray angulation. Always cases like this, you have to take X-ray from different angulation, and you can, in different angulation, you might be able to identify that the implant and the root are in different way, they're not touching. Okay. So one more time, always identify the prosthetic platform. And once you identify it, see if I have a step like this, that would be platform switching. Or if I don't have this step, so it means the prosthetic abutment, the prosthetic crown, and the implant fixture, they are flush. They're in same line. There is no a step over there. And so that would be an implant without platform switching. Reminder, platform switching is something that we only see with bone level implants. Okay. Only. So if I see a platform switching, it means that's a bone level implant. So that is like a guarantee that it's a bone level implant. Okay. So that is actually a good help, because right now, as I said, more than 80% of the implants in the market, their bone level implants have a platform switching. It's very trendy these days. Okay. Implants with more aggressive threats and with platform switching. Okay, so that brings me to the final terminology discussion of this lecture, and that would be what we already discussed a little bit about, but now we go in more details. and that is the implant fixture type. So in general, we have two types, tissue level and bone level. Okay. The tissue level is the design that was developed earlier, and the implant fixture has this component, okay, which we call a smooth collar. And this smooth collar, as the name shows, is very smooth. Okay, it's very, very smooth. And this is for the attachment of soft tissue, fibroblasts. Okay, it's not designed for the attachment of osteoblasts in comparison to the rest of the implant fixture. So this one has a rough surface, and this part has a smooth surface. So this smooth surface must be placed above the alveolar crest. And the rough surface should be placed inside the alveolar bone. Okay? That is how this implant design was developed. So I have a smooth collar, so the soft tissue attaches to it. On the rough surface, and by rough, I'm not just talking about the macrostructure, I'm talking about the microstructure. Microstructure means surface treatment, SLA, SLA active, sandblasting, okay, TPS, titanium plasma spray, okay. We have different, or hydroxyapatite coating. We have different surface treatments. We have the resective surface treatment, the additive surface treatment like hydroxyapatite, which is not very popular anymore. The majority of surface treatments right now are resective. It means they create some irregularities, some porosities by different methods, but at a very like microscopic level. So you can detect those small surface porosities by eye, okay? But they exist, and they actually improve the BIC, bone implant contact, because they increase the implant surface area. So in both tissue level and bone level implant, the part which is placed inside the bone should be very porous, okay? Should have irregularities to increase the implant surface area. That way I have a better bone implant contact, which helps with the secondary stability, which helps with a more reliable osseointegration, okay? So this part, very porous. It has the porosity, and it has also this macrostructure. This macrostructure not only helps with increasing the surface, but helps with anchoring the implant inside the bone. Okay, so like it screws the bone. It helps with the initial stability. So the macrostructure, these threads, any thread design helps with the initial stability. So the more aggressive the thread, as you see, for example, with BLX or Nobel Active. Okay, Nobel Active actually was the first implant design, or one of the first implant design that they came up with the very aggressive thread design. The more aggressive, the sharper, wider these threads, they help to achieve better initial stability, make them ideal implants for immediate cases. Okay. So one more time, I identify the implant prosthetic platform. This is my prosthetic platform. Then I pay attention to the apical 2 to 3 millimeter. Okay. If the apical 2 to 3 millimeter is very smooth, very, very smooth, and it's placed above the alveolar crest, then most probably that implant is a tissue level implant. Okay. But once I detect the prosthetic platform, if the apical 2 to 3 millimeter is It has some irregularities, like this. We can in some designs like the Osstem that I showed you, it can be a little bit more visible. And the implant is placed at the level of the alveolar crest or below the alveolar crest, which is the more common approach these days, considering the zero bone loss concept. Then that would be a bone level. Okay. And I will show you some examples that help you to better identify the implant types. But 80%, 70% of the implants in the market, they are bone level. Right now, the bone level implants are much, much more popular because of their like superior performance in aesthetic zone. Okay. With the tissue level implant, this part can the smooth color can show through the gingiva. That makes them not ideal choices for anterior sextant, okay? Or whenever the implant, like, the gingiva, the pre-implant tissue become visible when the patient smiles, okay? But still, I think that there is like a re-emergence of tissue level implant because honestly, at the end of the day, tissue level, especially in the posterior area, they perform better, at least in my hands. I use tissue level whenever possible in the posterior sextants, okay? Um, so let's just go, so from here, I'm going to talk about some important implant brands that are placed in Canada, okay? And the reason that I'm talking about these brands is not because you guys should identify the brand of implant, but if you see the design, if your eyes become familiar with this design, then when you see in the exam or when later you see in your practice, you can tell, okay, by looking at the design, okay, this is a tissue level or this is the bone level. And we start with the bone level implant because they are way, way more popular and commonly placed, okay? So what are some implant brands that you guys see more often here in Canada? A Straumann, the most, you know, actually it's the most successful brand. It has probably 50% of the market right now in North America. And BLX, BL, and BLT, okay, bone level taper, and BLX. These are the implants that are very, very popular, very expensive as well. Nobel BioCare, like the active, they have like different designs. You don't know, you don't need to know them. Biohorizon, a popular brand, an American brand in North America, very popular. Osstem or Hiossen, a very good quality Korean brand. Zimmer and Biomet, so they join, and pretty good quality American brand. Neodent, which is right now under the umbrella of Straumann. Straumann purchased Neodent. It's a Brazilian implant, but it's a good implant. I never placed a Neodent. I'm not a very huge fan of the implant design, but based on the feedbacks I received from my colleagues, they're pretty happy with Neodent. Dentsply Sirona, they have their own implants. So they have several lines of implants. MIS and Megagen, another two very good performing and popular Korean implants. Dio is also another very good quality Korean implant that are available in the American market. Okay, so I'm going to show you some of these implants, how they look like on the X-ray, and there's some of their important features. Starting with the Straumann bone level and bone level taper. So bone level, you can see it looks like a cylinder with minimal taper, and you can see some micro threads toward the coronal, especially it's more visible in the BLT. And in BLT, the apical half or the apical two-third has a very like significant taper, okay? And this is the BLX. BLX, the coronal 2 millimeter has very, very fine micro threads. But looking at the apical or the rest of the implant fixture, you can identify these aggressive threads very easily. Excuse me. Let's set them in action. So this is BLX that I placed immediately after the tooth extraction. You can still see the the socket, the lamina dura. Still some evidence of grafts that we used. And you can see the coronal 2 millimeter of the implant. You see some micro threads. The rest, we have these aggressive threads. Look at the prosthetic screw. So this is the prosthetic screw. And this is the prosthetic abutment attached to the crown. So this is the case that we used a screw retain crown. This is the prosthetic screw, okay? Sitting inside the implant fixture. A PFM crown and an all ceramic Emax crown, and this one, okay? This is the bone level. You can see the implant was placed subcrestally, which we do very commonly in cases of immediate implant placement. This is the platform switching. Look at this step. Okay, platform switching. This is a narrow implant which was placed at site 1, 2. Okay. Another case of bone level taper. This is BLT. Okay. This case shows some pre-implant bone loss that we will discuss later. But by looking at the implant and the moment I see this step, I can say, okay, this is a bone level implant, okay? Although the implant platform is above the alveolar bone, but the fact that I have platform switching, okay, I don't see any evidence of a smooth color. And if I pay close attention, I can see some evidence of some very mild irregularities here. That helps to identify the type of implant and the presence of pre-implant bone loss, which is another very important, finding that they always ask, okay? Floor of the sinus, okay, some evidence of calculus, composite restoration, some evidence of periodontal bone loss, okay? Zygomatic process of maxilla, other important findings that you guys can detect on this X-ray. Another example of a Straumann implant. Look at the cylindric design. This is the BL. Okay. Please note the platform switching. This step. Once I see this step, that's a no-brainer. It's a proof that this is a case of a bone level implant. Okay. Some effective PFM crown, a little bit pre-implant bone loss I see, which is considered normal. 1 to 2 millimeter pre-implant bone loss that happens within the first few months or year, that is considered as normal, okay? It's not concerning. 3 millimeter and more, no, it's getting a little bit too much, okay? Very important implant, Straumann. So you guys just make sure you see good amount of X-rays related to this implant. Then we have the Nobel BioCare. They have different design. Double BioCare has tissue level, has bone level, but the bone levels are very, very more popular. And when you pay attention to the Nobel BioCare, you can actually appreciate this micro threads in all different lines, more obviously. Okay, it's very, very like clear micro thread design that can sometimes become a little bit confusing. But right now, Nobel BioCare implant design, they all have platform switching, okay? The bone level, obviously. So once I see the platform switching, as I see here, I can say, okay, this is a bone level implant. One more time, guys, they don't ask you about the implant brand. I just put the brand so you guys become more like familiar with the design of implants that you may get in the exam. So you can see here the more aggressive threads, the micro threads, implant platform. This is the platform switching, and the prosthetic abutment and the crown, prosthetic screw inside, no evidence of pre-implant bone loss. Okay. Another example, you can see the threads, the platform switching. Once I see the platform switching, it's very obvious. This is a case of bone level implant. In this case, it was placed subcrestally. Okay. Composite restoration, remnant of lamina dura. Okay, and let's see one example of novel active, way more aggressive threads. The coronal 2 to 3 millimeter, we see the micro threads. And this fine platform switching that makes this case very obvious, okay? Bone level implant with no pre-implant bone loss. This is my platform, okay? You have some periodontal bone loss here, but in terms of pre-implant, it looks good. It looks fine, okay? And pay attention to this prosthetic abutment. So this is a prosthetic abutment which was placed. Okay, another very popular implant here in Canada is Biohorizon. Very popular because if you check the reference by mesh, it was also a very strong advocate for Biohorizon implant. The majority of implant, most of the implant placed in his textbook are Biohorizon. Biohorizon, they have different implant lines, but this one is the most successful and most popular. If you look at the threads, they have this, this design, the active threads, and the coronal part. You see these micro threads. Some of them, they are laser coated, okay, or laser treated. It can be a little bit confusing sometimes, okay? And just remember, Biohorizon is one of the bone level implants that some of the implants, they don't have platform switching. So I can say Biohorizon can be very tricky because we have bone level implants without platform switching. Pay close attention to this implant design. We have Biohorizon implant with platform switching and without platform switching, okay? You see it in other designs, we still have this thread geometry and the coronal 2 to 3 millimeter, the micro threads, very, very fine, okay? If you pay closer attention, you can see the micro threads are so delicate here. And it can sometimes give you the idea of a smooth collar, which is not, okay? This is the implant line that has platform switching, bone level with platform switching. But We do have Biohorizon implants without platform switching. So it means that this is flush. Okay. But there is no step. I see absolutely no step there. And having this design, this micro thread, can be a little bit sometimes tricky. Okay. But this is a Biohorizon implant placed. This is the implant platform, some micro threads, and this design of threads, macro threads, very characteristic of a Biohorizon implant, okay? And here I do have some platform switching. Against even looking at healing abutment in many cases, not all, but looking at the healing abutment, I can tell there is a platform switching or not. And here I have platform switching. But take a look at this implant. This implant is a Biohorizon bone level implant. So this is my prosthetic platform without platform switching. Okay, I don't see this step. So yes, I can have bone level implants without platform switching. That can exist. And you can see an example, a very important example of bone level implants without platform switching. This is the prosthetic platform, and this is the micro thread. Very, very fine and confusing micro threads. Give you the like the feeling that it might be a tissue level, but it's not. Okay. That's why I'm emphasizing that you guys should become familiar with different implant brands, because Biohorizon is one of those implants that we see very popular, very common, but it's not, it doesn't have platform switching, and it's not, tissue level. So what implant do you think this one is? So take a look at this implant, and I think by now you guys should be able to tell the type of implant and whether I have platform switching or not. Yes, this is a Biohorizon implant, bone level. This is my prosthetic platform. It's bone level, and there is no platform switching. You see the prosthetic abutment? It is flush with implant fixture. There is no step. The crowns are splinted, and there is no evidence of pre-implant bone loss. My bone level here, and bone level here. Okay. So two Biohorizon implants with bone level design and no platform switching. Another popular implant, Osstem or Hiossen. They're very easy to identify. They are bone level. Look at the platform, prosthetic platform. With the platform switching, always search for the platform switching at the implant prosthetic platform. That's where platform switching happens. This is the case that I showed you earlier. This case I also showed you earlier. You can see this platform switching here. Look at the threads. By moving toward the apex, become more significant, more aggressive. High quality Korean implant, okay? They have different lines. They just introduced, a couple of years ago, they launched their tissue level implant as well. Zimmer is a popular implant. The design is more like this. This is the design we see with most of the implants, okay? It has a mild taper, very mild taper, from the prosthetic platform to the apex. And the threads, as you see, the coronal 1 millimeter, we have micro threads, but the macro threads, they're very obvious, because they're implants, they don't have they do have platform switching. Their identification is very easy. You can see, yes, as I said, this is the implant platform, prosthetic platform. Apical to that, I have 1 millimeter, very like narrow micro threads, and the rest we have micro threads. Very obvious. You can't go wrong with this implant. Take a look at this step. I have platform switching. Look at the extraction socket. Okay. No evidence of pre-implant bone loss. Another example of Zimmer. You can see the design. This is the implant prosthetic platform. Minimal 1 mm micro thread, and the rest is macro thread. Pretty obvious. I can see some evidence of platform switching. I do have some periodontal bone loss. Okay, but pre-implant wise, everything looks good. Okay. Another example of Zimmer Biomet, but this is a different design. So this design is more for immediate cases or cases that you want to get better initial stability, like in posterior maxilla. So this design has more micro thread, but the apical part, the threads are very aggressive. Okay. So here a healing abutment is placed, and even by looking at the healing abutment, you can see the evidence of, a lot of the evidence of platform switching. Okay. Neodent, another popular Brazilian implant. The design is in a way that the implants, they do have a very pronounced taper. So from the platform of the implant, the prosthetic platform to the apex, we have significant taper. So the wider implants, the implant looks like this. So this taper is very characteristic of this implant design, and it tends to give the implant the ability to kind of achieve good initial stability in the more chronal part of the implant. Okay, so you can see it here, some micro threads, kind of aggressive macro threads. And yeah, this is the design I'm talking about. Very significant taper compared to the other implant designs. Okay, especially it's more obvious in wider diameters. Okay, and they do have a very significant platform switching as well. So this is step when you compare it to other implants to other brands. This step is very pronounced and clear in Neodent implant. Okay, again, a bone level implant with platform switching. Some evidence of torus. Implants are placed nicely. No evidence of pre-implant bone loss. Okay. And the remaining implants are, for example, MIS. Again, bone level implant with platform switching, 2 to 3 millimeter micro thread. The rest we see macro threads. Dentsply is also another popular implant, not as successful as the previous implant that we discussed. This is the Astra, used to be very, very popular in the past. In Astra, we have almost, depending on the length of the implant, 2 to 3 millimeter micro threads, and the rest very fine, not very aggressive macro threads. You can see one example here. They do have platform switching. Okay. Look at the micro threads and macro threads. We do have some evidence of pre-implant bone loss. And here, this is a case of dislodged restoration and broken prosthetic abutment. They don't ask about these details. Okay. So these are Astra. another like abstract thing. I talked about it. Again, look at the micro threads and macro threads, platform switching. So this is my reference for bone loss, this platform switching. So bone should be at this level or beyond that, more chronally, okay? So it means for this implant, for the first implant from right, I do have some bone loss. But for the second implant, no evidence of bone loss. Note the space loss because of the mesial migration of this molar. Okay, some periodontal bone loss you can see around these teeth. Okay, so what type of implant is this? Now that we covered the majority of popular implant brands in Canada, what type of implant is this? Do we have platform switching or not? And do we have pre-implant bone loss or not? I'll give you a couple of minutes. Yes, this is a bone level implant. This is my prosthetic platform. These are the steps that you guys should go. First, identify the prosthetic platform. This is my prosthetic platform. Okay. So what do I have apical to the prosthetic platform? The apical to the 3 millimeter. It just have very fine irregularities. Very fine irregularities. So it's not a smooth scolar. So that means this is a bone level implant. Okay. Do I have platform switching? No. Okay. So since below the prosthetic platform, and this is a bone level, and bone level, I said the prosthetic platform should where I have bone attached to. So apical to the prosthetic platform, I do have bone loss. So this is the case that I have pre-implant bone loss around both implants. Okay. What type of implant, which implant brand? Biohorizon. The one I said it's very tricky. You remember? We talked about Biohorizon. Here we go. This is the very same implant. Prosthetic platform, micro threads. I said it can be laser coated, very fine. And then this type of thread, kind of like reverse buttress threads. Okay. So these are like the most popular bone level implants in Canada. We do have tissue level. Tissue level is, as we said, not as popular, but you guys should be able to tell the difference. I'm just gonna review one more time. For tissue level, usually you have a smooth scolar, and the smooth scolar in most implant design has this design. So it means it has a little bit emergence profile. Okay. And then from here, I do have the rest of the body of implant. So this part, the smooth collar, is supposed to be placed inside the soft tissue and the rest inside the bone. Depending on the implant, the lengths can vary between 2 to 3 millimeter. Okay. Some implant design, they have a little bit shorter smooth collar. Okay. So when I say 2 to 3 millimeter, it means 1.8 to 2.8 millimeter. I just give you a rough number. But some implant design, they have a little bit shorter smooth collar. But that's the average. And then on top of that, we have the crown, and there is no platform switching. Okay. So always detect The prosthetic platform, so in a tissue level, this is my prosthetic platform. This is my prosthetic platform. This is the soft tissue. And this is my implant fixture. Okay, so I'll have this in mind, and here we go. The most popular tissue level implant in the market is a Straumann. Tissue level, TL and TLX. TLX for immediate cases, or poor bone density, and TL for the regular cases. Nobel BioCare Replace has a tissue level. Zimmer Biomet, they do have their design, and MIS, Osstem, they all have their tissue level implants, but they followed almost very similar design, okay? Let's just see the most popular one, which is the Straumann. So this is the short tissue level. Look at here. This is the smooth scalar, very, very, very smooth, absolutely no irregularity, has this emergence. Why do we have this emergence in the smooth scalar? Do you know why we have this emergence in the smooth scalar? Because the implant platform, prosthetic platform, is shallower, is more toward the occlusal surface of the final crown. So this helps to develop the final crown emergence profile. Okay, so I do have this, so it helps me to have this. If I didn't have this design in the smooth scalar, let's say I have like this design. We do have this design for the tissue level, and that is where we have very narrow space. Then my crown would be like this. So it creates a very unnatural emergence profile. And I do have some horizontal cantilever, okay? But we do have this design when we have very narrow space and we want to place tissue level, okay? Look at here. This is smooth scalar, 2 to 3 millimeter. And these are, and this is the TLX. Okay. Again, 2 millimeter of a smooth scalar, some micro threads, and very aggressive macro threads. Okay. You see the neck height, the smooth scalar height, 1.8 and 2.8 millimeter. And that depends on the soft tissue thickness. If I have a very thick soft tissue, I go with this. If I have a very shallow and like narrow soft tissue, and I have insufficient, crown height space, CHS, then I go with the smaller or like, shorter, a smooth scalar or neck. And as you guys see, the implant, the smooth scalar is placed inside the soft tissue, okay? And this is my prosthetic platform. So the crown comes and sits here. My final crown is going to come and sit here. So this is going to be my prosthetic platform. And the prosthetic platform is placed above the alveolar crest normally. How much? 2 to 3 millimeter. Okay. Therefore, in cases that I have the tissue level implant, identifying the pre-implant bone loss is very, very tricky. And in the next lecture, I'm going to talk about it in more details. Okay. Okay, and look at different designs for this for the tissue level implant. And this is the TLX line. Let's see a few examples. Look at this implant. This is the prosthetic platform. The crown is placed on top. And look at this taper. Look at the fact that it's placed above the alveolar bone. Not a great case for placing a tissue level. This is an anterior tooth. This is a central incisor, but they placed it, okay? Probably the patient had a low lip line, didn't show that much, okay? But this is a case of a bone level, a tissue level implant, okay? Tissue level implant, no platform switching. All tissue level implants have absolutely no platform switching, meaning the crown is placed like this. Okay, it's flushed. Look at this emergence we see in this area. You can see it even here. Okay, but this is a more ideal example of using a tissue level implant in the posterior sextant to restore a molar. Okay, works very nicely. You can see again, this is the implant. I just moved it here. Look at this type of emergence. This is my smooth scalar. So my bone should start here, and that's what exactly I see. This is a very successful tissue level implant. My prosthetic platform, smooth scalar, and the implant fixture with surface treatment with prosthetics, which should be placed inside the bone. One more time, this part of the implant fixture inside the bone, this part of implant fixture inside the soft tissue, and the rest is the crown, which is inside the oral cavity. Okay, take a look at this picture. In tissue level implant, this is a tissue level implant. Tissue level is Straumann. This is my microgap. You see, the microgap is away from the alveolar bone. That's why in tissue level implants we have less bone loss. In bone level implant, the microgap is right at the alveolar bone. Microgap is where the crown and prosthetic abutment attaches to the implant fixture. So this area. So if I don't have a platform switching, this microgap can create a microbial pump, push the bacteria deep inside the bone, create alveolar bone loss. Okay, but that is not part of this lecture. Okay, so what you guys should pay attention to at the end of this lecture, just want to summarize what I said so far. Identify the type of implant by looking at two things. The very first thing is the prosthetic platform. Where is my prosthetic platform? My prosthetic platform for a bone level implant should be placed at the alveolar bone, at the level of alveolar bone. And we are talking about the ideal scenario when we have no bone loss. At the level of alveolar bone or below the alveolar bone crest. That would be for the bone level. For the tissue level, my prosthetic platform is placed 2 to 3 millimeter above the alveolar bone crest. Okay. And I have this smooth scalar. So this is the second thing I should pay attention to. Do I have a smooth scalar? So first, prosthetic platform. Second, a smooth scalar. Third, platform switching. If I have platform switching, that's a guarantee that this is a bone level implant. If I don't have a platform switching, it may be bone level, it may not. I showed you in case of Biohorizon implant that we have a bone level implant without platform switching. Okay? So let's just see a few examples to see if you guys are able to tell the type of implant fixture. Starting with this one. I'll give you a couple of seconds, actually. So you guys should be able to tell very quickly. Yes, these are bone level implant with platform switching. These are BLX implant. You can see some mild platform switching here. Look at these aggressive threads. This is my platform. These implants have been working for the past 5-6 years. I placed these implants, both of them immediately, and restored them in 3 months, and they've been working pretty nicely so far. What is this implant? We had this X-ray earlier, but that was before restoration. First thing first, identify the implant prosthetic platform. This is my prosthetic platform, and this is my prosthetic platform, okay? So you guys pause the video, write down the type of implant, and then you press continue to see the final answer. So my prosthetic platform, it's above the bone, yes, but do I have a smooth collar here? Do I have that design of a smooth collar here? No. Do I have micro threads? Yes, I have some micro threads. Pay closer attention. You can see that small micro threads below the prosthetic abutment. So both of them are, do I have platform switching? Yes, I do have this step. Look at this step here. So both of them are bone level, platform switching, pre-implant bone loss. We will discuss in the coming lectures. What is this implant? What components do you see? Yes, I should first detect the prosthetic abutment. This is my prosthetic abutment. What I have on the top is a healing abutment. Look at this design. Look at this design. Look at this smooth collar. So the smooth collar is placed above the bone. And this is a case of tissue level implant. I do have healing abutment. No evidence of pre-implant bone loss. This is a case I place immediately after tooth extraction. This is before the attachment of the healing cap. So you can see the implant. Implant is TLX by Straumann. Pay attention to this design. Okay. And this is a tissue level implant, no evidence of bone loss. What type of implant is this one? I don't know what brand this one is, but I can see the threads exposed. And this is my prosthetic platform. So this is a bone level implant, no platform switching, and I have pre-implant bone loss. Okay? Because my threads are exposed. I don't have the design of a smooth collar, so this one cannot be tissue level. You can see PFM crown, stainless steel, prefabricated post, acceptable root canal, some evidence of amalgam debris. Okay. This one, we had the picture earlier, another bone level implant. Look at the prosthetic platform, threads, no smooth collar, some evidence of like platform switching. So bone level implant, platform switching, no pre-implant bone loss. Here, You see bone level implant. This is my prosthetic platform. So this is bone level. This is the healing abutment. And sorry. And if you pay attention, you can see the platform switching. Okay. Both of these implants are Hiossen, but different designs. They have 83, 84. Okay. Another example, two Korean implant, Dio and Hiossen, Osstem. You can see this is the prosthetic platform. Below apical to the prosthetic platform, I have threads. So that makes it obviously bone level. Do I have platform switching? Let's take a look. For both of them, yes. I do have platform switching. There is a step. Okay, and no pre-implant bone loss. What about this? Another case that I placed two different implants. One is bone level Straumann BL. This one is Hiossen ET3, which is a bone level implant. Both of them, they do have platform switching and no evidence of pre-implant bone loss. Take a look at this final X-ray, very nice X-ray. This is a patient of mine. He had placed this implant probably 20 years ago at site, I don't know, 3.6 maybe, yeah. And I just placed a 3.7 for him. And look at this design. Look at this nice emergence that I see. So this is my prosthetic platform. This is where the crown sits on top of the implant. And this is my smooth collar. Look how smooth the outline is. It's very smooth. And this is the rest of the implant fixture. So what type of implant is this? Yes, tissue level. This is the tissue level, beautifully done, no evidence of bone loss. Now compare this implant, BL by Straumann, with this implant. Okay, this is Osstem. Look at the platform switching. A bone level implant with platform switching. So when done properly, both implants, they can work very, very successfully. So tissue level, not bone level. Tissue level implant versus bone level implant. A TL, look at the design. A tissue level implant with the smooth collar. No evidence of pre-implant bone loss. Okay. And a bone level implant with platform switching. No evidence of pre-implant bone loss. Okay. Both successful. Okay, so thank you so much, guys, for your kind attention. If you have any question, you can just post it here. You can just send it to me. And I hope to see you guys in the upcoming lectures. Make sure to give me your feedbacks about this video. And I hope to see you guys soon in our next CONFITALK. Take care and have a wonderful day.